Hi everyone. Having discussed the general mycology, let us now start with the mycosis based on the location. First, we'll talk about the superficial mycosis, which will take care of the superficial structures like the skin and the hair. And thereafter, we'll go to the subcutaneous tissue and talk about the four main diseases that come under it. Starting off with superficial, and as I said, the skin and the hair. So the first disease that comes under superficial mycosis is tinea versicolor. What you know as tinea versicolor, or another name that is pityriasis versicolor in dermatology, that's the name of the disease. But the fungal organism that causes it is known as Malassezia furfur. While most students study about Malassezia furfur, they have started to believe that this is the most common fungal organism causing tinea versicolor. But I wish to point out over here that even more common than furfur is Malassezia globosa, and thereafter furfur comes. But mostly you get a question on Malassezia furfur only. So let us get going with that. Since it's a skin infection, you can see what kind of lesions are present. On the back of this patient, I can see that there are lesions which are multiple and they are hypopigmented. So that's not always that they will be hypopigmented, that is usually. Because in dermatology, even hyperpigmented lesions have been reported, but with MCQs, mostly you're getting hypopigmented lesions. And you can see the location, it's on the back and the trunk. As a dermatology rule, whenever you have a rash or a lesion, you tend to do a wood lamp examination, which is examination under ultraviolet light. And these lesions under wood lamp examination are going to give a bright yellow fluorescence or golden yellow fluorescence also, as it is described. Now, as the rule says, if you have a lesion in the skin and you're suspecting a fungal infection, you're going to do a skin scraping. And the first thing that we apply is going to be a KOH, potassium hydroxide mount. So over here, we are going to take the sample of the patient, which is a skin scraping, and put a 10% KOH mount. I taught you in the first part of the video that KOH is K for KOH and K for keratin digestion. It is going to remove all the keratin and then you will be able to see the fungus. Now, if you remember from the general again, Malassezia tends to come under the yeast-like arrangement. A yeast-like arrangement will tell me that it is going to have both the budding form as well as the pseudohyphae. So there are these small areas which are known as the buds, as I can see over here, the small yeast-like situation, and then you can see these long threads which are going to be the pseudohyphae. Well, this on the basis of imagination has been called as, the pseudohyphae have been imagined to be the long spaghetti pasta and the buds have been imagined to be meatball. So this is spaghetti and meatball appearance, and before the vegetarians feel offended, if you're vegetarian, you can also learn the other name, that is banana and grapes appearance, where of course the banana is denoted to be the pseudohyphae and the grapes are the buds that we have. Now, as soon as you see this on a KOH mount, of course the next thing you want to do is a culture, and there we go with it. In fungal organisms, you do everything that is under SDA. The first culture media that we use is Sabauroud's dextrose agar. So in most of fungal organisms, it is just a plain Sabauroud's dextrose agar which will grow the organism, but here it's not so. Malassezia is a lipophilic organism, means lipo is fat and philic is loving. It's a fat loving organism. If you want it to grow, you will have to give it some kind of fatty material for the growth, and that is why we cover the SDA with olive oil. And as soon as you do that, you see the characteristic fried egg colonies, which I want to zoom in and show you that there's a halo in the center and then there's a whitish area around. So this is the colony, there's a whitish area around. This is the classical fried egg appearance, but if you want the eggs to be fried, you will always have to use oil, and that's just a way of learning it. Well, the story doesn't end there. Of course, once you've done an SD or a culture, the next thing that you would want to see is look at it under lactophenol cotton blue, because that's the stain you use for culture morphology, and we already know what you're going to see over there. You are going to see those hyphae, which is going to give you the spaghetti and meatball appearance later on. Now, along with that, before I move forward, I hope you remember where all do you see fried egg colonies firstly, and secondly, where is the spaghetti and meatball appearance also seen? So let's make two summary charts. Spaghetti and meatball appearance is seen in tinea versicolor, like you just now saw. But when you go to pathology and you study under pap smear, so trichomonas and leptothrix, where trichomonas is going to be the ball-like pear-shaped organism, and leptothrix is the long one that you notice, the long bacteria. So that is trichomonas and leptothrix show you spaghetti and meatball. Now coming to where all do I see fried egg appearance. In microbiology, the first M where I see it is this fungus Malassezia furfur, and the second one is a bacteria, that is Mycoplasma colonies are fried fried egg. Now, fried eggs in pathology, how can you forget that brain tumor where you used to write it with all the eggs, that is oligodendroglioma, shows you a fried egg appearance. When we talk about testicular and ovarian tumors, it is seminoma in the testes and dysgerminoma in the ovary. Their histopathology is fried egg. And in hematology, it is the hairy cell leukemia, and please mind it, it is the bone marrow biopsy of hairy cell leukemia which shows you a fried egg appearance. So these are all your flashcards which are ready, which gets me back to the fact that I was talking about malassezia furfur and I'm left with the management or the treatment. If it's an initial case, you can go in with topical therapy, and that would include a 10% sulfur ointment along with an imidazole cream. If it is a severe case and you want an oral administration, you can go in for the azoles, that is itraconazole or fluconazole. Another easier way of learning it, it's an azole cream and an azole drug that you're going to make the patient eat. So of course you're done with the first infection, and now moving on to the second one, which is going to be tinea nigra. Nigra word anyway tells me that I'm going to have something which is a hyperpigmented lesion. So let's start studying about it. Tinea nigra, that's the name of the disease. The organism that causes it is going to be Hortae wernickeae. Now, one thing that you'll notice in fungus is that whenever I will have something related to hot, sounding hot, of course, if you heat food or if you heat anything, it tends to become charred or blackish. So you will always notice that whenever the organism has the word hot in it, the patient is clinically going to come up with a pigmented lesion. So tinea nigra is caused by Hortae wernickeae, and that is going to show you a pigmented lesion. Do you know this organism is actually halophilic? Halophilic always means philic is loving, halo is salt. It is salt loving, so it is always going to be found in salty water. Who are the people who are constantly in contact with salty water? It is the fishermen. So their hands have the maximum chance, because of being in contact with the sea, ocean water, their chance of getting a tinea nigra infection is the maximum. Of course, when you look at it under a KOH mount, you can see that the same kind of hyphae that are there, but this time they have a very brownish color, because inherently I can see that this is going to be pigmented. What do you do for the treatment? As we always do, it is going to be an azole, that is a topical imidazole, which we are going to apply. So the second one is also done. Let's also talk about a little bit to do with hair, and that is known as piedra. Now in piedra, there are two types. You can see this is a hair shaft, as you can see clinically also over here. Sometimes in some people, you will see that either some black nodules are going to be stuck on the hair, or some white nodules are stuck on the hair. This is not dandruff. Dandruff is something that is stuck on the scalp. I'm talking about nodules being stuck on the hair, and that is a fungal infection called piedra. So of course, if the black nodules are stuck, you call it black piedra, and if white nodules are stuck, that is known as white piedra. They ask you what are the organisms. So let's start with white piedra. It is caused by Trichosporon Beigeli. Now Beigeli sounds a little bit like Bijli, which will always remind me Bijli is light, and light is always white in color. So Bijli is always going to cause white piedra. And how does white piedra look like? You can very well see that there are white soft nodules which are going to be present. Usually they are either present on the face and the scalp, or they can also be present on the pubic hair. Now going on to the black piedra. So of course the black piedra will show you these black nodules, and I can see those present, but they are a little harder. They are harder ones, and they are present on the scalp hair. Which organism causes it? It is going to be piedra hortae, which is very obvious, because piedra will tell me it's piedra, and that's the name of the disease. And hortae, I told you, wherever something is going to be named as hot, it is going to make the pigment come out, and that's why you can see that the hot will remind me of black. So now the organisms become easy, because piedra hortae will cause black piedra, and Trichosporon Beigeli or Bijli will cause white piedra. So no one's forgetting the organisms, I'm sure. What do you do about the treatment? Now, of course, if it's the hair that are affected, you will have to first cut or shave the hair, and after you've done that, you will have to put an azole topical treatment, that as you've been doing in the previous fungal infections also. So now, having done that, let's go on to the lengthiest superficial one, and that is dermatophytosis. Now the name itself is telling me that okay, this is related to derma and everything in the derma, like hair, skin, nails. Maybe you don't know it by the word dermatophytosis, and maybe you know it by the fungal infection which they call as the ringworm infection. So we'll talk more a little bit about it. Now we will first tell you that dermatophytosis, for the layman, for the non-medico to learn this is very difficult as a disease. So what they learn it is either as a ringworm infection, or they learn it as the teniasis, that is the tinea infection. But for medicos, this is a group of 3 organisms. Those 3 organisms are learnt as TME. What is TME? That's the URL we use for Telegram. Whenever you have to search for someone's Telegram group, it is TME dot, let's say, Preeti Sharma channel. That's how you search for for it. So TME are the three organisms, that is trichophyton, microsporum and epidermophyton. Now there will be confusion, not in microsporum, that is okay, not in epidermophyton, that is also okay. Usually students get confused with the T because what I'm talking about is trichophyton, but before this when I was talking about white piedra, I spoke about trichosporon BHL. So please don't make every tri come under one loop. How do I learn it? So the BHL one was trichosporon, and when I'm talking about dermatophyte, everything has to be phyte. So it's trichophyton, epidermophyton. So you've learned the name of the three organisms, but what do they affect? Please note that tri word tells me that this is going to affect everything, that is the skin, hair and the nails. Microsporum only affects the skin and the hair, and epidermophyton affects the skin and the nails. I mean, learning tri for all three is going to be easy, and obviously skin involvement will be seen with all. I will get confused where hair and where nail. A very violent mnemonic, but everything's fair in love, war and mnemonics, as we say. Epidermophyton, whenever you're trying to fight, you're going to fight with nails and scratch the person off. So epidermophyte, to fight you need sharp long nails, and that is why in epidermophyton there is going to be nail involvement. In microsporum there is going to be hair involvement. Now moving forward, any kind of derma infection or derma disease, you are going to do a Woodlam's examination, and this over here tends to show you the apple green fluorescence. In pathology we read about apple green birefringence. Now that is seen on application of Congo red when you are trying to study a myeloid under a polarizing microscope. Here I'm talking about apple green fluorescence. Why? Because Woodlamp examination basically uses an ultraviolet light that gives a fluorescent texture. Now moving forward and talking about that, what are the different classifications when it comes to microbiology. And I know this slide is not everyone's favorite and nor is it mine, but I have tried to find a way out of how to learn it. When I'm talking about at least the T's, you know, T's are trichophytons, the M's over here must be the microsporums, and if the E's are there, they are epidermophytons. At least you know the first three alphabets. Now how do I learn the other names that have been written over here? First, look at their category. Either they are going to be geophilic. Geophilic means that they are going to be present in the soil, in the geography. Okay. Zoophilic, zoo tells me animals, so these are the ones which are going to also cause animal infection or may be found there. Whereas when I talk about anthropophilic, this is the one that can be found in humans and the environment. So what I've done, the lengthiest list I have left behind, I have said that let us learn the ones which are going to cause disease in animals and the ones which are going to cause disease or are going to be present in the soil. So in the soil, we have learned trichophyton terrestri, because terrestrial reminds me of geography, and microsporum gypsum. Gypsum is also a very important thing that is found in the environment. So gypsum and terrestri are to do with geography, and hence I put it under geophilic. Now let's talk about zoophilic. Zoophilic is to do with animals. So when I read trichophytum equinum and microsporum equinum, equine means horses, that's an animal. Microsporum canis, canis means dogs, again an animal. And trichophyton verrucosum, ma'am, here's the catch, you don't have an animal with verru. So can you give a pet name to an animal with verru? Verru sounds like sheru. Sorry for that really absurd mnemonic, but there's no other way to learn this, right? So whether they're talking about horses or dogs or veru sheru, that is a lion, just a way of learning it, you are going to think of it to come under animals, that is a zoophilic particular dermatophyte. And everything else now that is left, whether it is rubrum, tonsurans, schondleni, violatium or ordini, all of these are going to be anthropophilic. Out of them, please note that it is tonsurans which is said to be the most common infection overall in the scalp that tends to occur, which I will tell you in a while. And one more thing about Taenia rubrum that you have to know is that rubrum has been named so because it creates a red color pigment. Overall, out of this entire table, if you are asked that why and which is the most common dermatophyte infection, overall it is going to be trichophyton rubrum. But if you ask which is the most common infection occurring in the scalp, that is going to be trichophyton tonsurans. Coming back, trichophyton rubrum giving the red color is going to create a red color pigment, and while it can cause any kind of skin infection, most commonly it is said to cause nail fungal infection known as onychomycosis. So we will study a little bit more about it, and this is a very microbiology classification. Ma'am, can you tell me all the things that you see in dermatology? One by one we will read them and then we will see the relevant derma pictures. Let me start with everything to be present in the scalp. First, I'm going head to toe, so I'm only talking about the scalp area. When this infection, dermatophyte, occurs in the scalp, I call it tinea capitis. How easy? Cap means scalp. So tinea capitis is going to be present in the scalp, and I just now told you the most common infection to be causing the scalp infection is going to be Trichophyton tonsurans, and hence I have written that once again. However, if the scalp starts showing you certain scales and crusts, imagine that whitish crust is stuck on the scalp, that is known as scutula, or that is also known as tinea favis, and which is caused by the organism Trichophyton schondleni. The third variation is that on the scalp, if you start seeing a water balloon like soft swelling, that water balloon like boggy swelling is known as carrion, and very commonly it is caused by mentagrophytes and verrucosum. You won't understand anything without pictures, so here you go. This is tinea capitis, where you can see the infection is number 1 present on the scalp, and I just now told you that it is Trichophyton tonsurans, which is the most common fungal infection causing this. Now on the same scalp, if you start seeing the presence of these crusts, which you can visualize very clearly over here, so that is known as tinea favis. Favis will always remind me of flakes and scales. That is also known as scutula. So split the scutula. The S will tell you that it is caused by which particular organism? Trichophyton schondleni. The S will also tell you that okay, there are scales and flakes, and that is exactly what you see with SC. This is going to have scales and flakes. Repeating, favis will tell you flakes, scutula will also tell you scales and flakes, and S alone will tell you Trichophyton schondleni. Now when this converts into, if you touch this, of course this is a 2D picture you're seeing, but if you touch it, it looks like a water balloon, it feels like a water balloon. That is known as carrion, and that is a boggy swelling, and this is a very famous previous year question, that what is this boggy swelling cause? So all of them were occurring on the scalp, and hence I put them together. So I realized that on the scalp we could see 2 types of conditions. In all of these there was some inflammation that was there, and hence these were all called as tinea. But on the other hand, the scalp can show you non-inflammatory involvement also, but that is more to do with hair involvement, and those are known as ectothrix and endothrix. What do I mean? So I have drawn 2 hair over here. If there is a presence of these spores present on the outer part of the hair, that is known as ectothrix. So that will come to you visually, it will look like a grey patch because hair will start falling also. On the other hand, endothrix will mean that there are some spores that are present inside, and I can see how they are filling up the entire hair shaft also. How do we learn the name of the organism? So please note, ectothrix is most commonly caused by Mycosporum canis, and endothrix is going to be caused by Trichophyton tonsurans. How should I learn this? I mean, it's obvious. Tonsurans was anyway the most common Trichophyton causing the scalp infection, so that I learned for endothrix, where the spores are present inside. But when I have to learn for ectothrix outside, canis reminds me of a dog, right? And dogs are always happier when they are taken outside and they are made to play. So ectothrix is going to be caused by the dog one, that is Microsporum canis, which is a previous year INICET question, and endothrix is caused by the most common scalp infection, that is Trichophyton tonsurans. Now coming all the way back, we are done with the scalp, we move on to the trunk. If the tinea occurs in the trunk is known as corpora. Trunk does not have hair. The corpora, non-hairy part, that is known as tinea corporis, as you can see over here. In this patient, you are seeing these ringworm kind of round annular lesions. It's a fungal infection, so patient will say I'm having a lot of itching, and corpora refers to trunk. One more question that I expect in the future INICET exam is asking you about a syndrome called as Mejoshi granuloma. Now what is Mejoshi granuloma? This is the same tinea corporis, means the patient is going to have these trunk lesions, but along with that the deep hair follicles are affected, so that is known as deep folliculitis. When they occur together, that is Mejoshi granuloma. Now coming back, after having done the trunk, let's see if the tinea occurs on the face. I'm not talking about the beard, I'm talking about the rest of the face. Tinea facie will be what is called for face. If the beard is involved, we are going to call it tinea barbi. I mean, that's also obvious. Now what if on the trunk or the body there are concentric lesions? Have a look at this. When I zoom into these lesions, I can see that they are actually forming these concentric appearances. So tinea concentricum, many names are given. It is known as tinea imbricata because it is going to show you concentric lesion. Imbric, concentric, that's how I have learnt it. Imbric will show you concentric lesions, and it is caused by the organism Trichophyton concentricum. So I think this is again a very easy one to learn. Moving on to the next one, we are now going to have tinea cruris. Crura refers to groin. So this is involvement of groin. Fungal infection always occurs when the area is kept moist. Why will the groin of a person person be kept moist is usually seen that either the person is wearing very tight clothes and that is he's sweating a lot, that could result in fungal infection, or it is a dhobi who tends to sit on the ground and wash clothes, so his groin area is constantly wet. So anything that is moist is going to attract a fungal infection. That is why tinea cruris is known as dhobi's itch or jock itch. Let's move forward. If it tends to involve the feet, now whose feet will always remain moist? The people who wear socks for a very long time, have sweating in the feet for a very long time. This means athlete's foot, and that is going to be known as tinea pedis for foot. Lastly, if the nail bed is affected, nail is known as unguum, so that is referred to as tinea unguum. You can see the fungal infection over here in the nail bed, and there you have it. So I think most of them were pretty much to do with the name of the bird. Tinea capitis, cap will tell you scalp. Tinea favus will tell you the flaky, scaly scutula. Carrion will tell you that water balloon. Corpora will mean trunk. Barbe is beard. Facie is face. Imbric is concentric circle. Crura is groin, so that's the dhobi one. Unguum is nail, and pedis is foot. When you read it this way, I think it becomes a lot easier. If you want to revise the pictures, if it occurs on the scalp, it is capitis. If it's a boggy swelling, it is carrion. If it's got crusts and flakes, it is tinea favus or scutula. If it occurs on the trunk, that is known as corporis. If they are concentric, that is known as imbricata. And if it is on the nail, it is tinea unguum. Now you've done all the clinical. You want to take a sample from it because you want to do lab diagnosis. The sample will depend whether it's a hair infection, nail infection, skin infection. You take the sample, and what do? Of course, the next thing that we put up any sample to is going to be a KOH mount. Usually we do a 10% whenever we are dealing with skin and hair, but for nails we tend to increase it to 20% KOH. Reason being, nail has very thick, it's got a lot of keratin, so you'll need more KOH to dissolve the keratin. Thereafter, you go in for a culture. Now, in a culture, usually we don't need to know the culture of every organism, but I've taught you that for tinea rubrum you definitely have to know, because it is going to result in a red color pigment, right? Now moving forward, after every culture you go in for LPCB stain, and that is exactly what they want you to see as pictures. LPCB is known as lactophenol cotton blue. So before I go on to the pictures, I want to remind you, what are the three organisms? The telegram mnemonic, ma'am, TME, trichophyton, microsporum, epidermophyton. When you look at them under lactophenol cotton blue, you are going to see two things. Some big conidia called macroconidia, some smaller ones called microconidia. Microconidia, as I see, is arranged in a descending order. That is, maximum microconidia with trichophyton, a little less in microsporum, and the least or almost absent in epidermophyton. So max to minimum is microconidia. We'll see pictures. For macroconidia, they are going to be big conidia, and each one of them has their own shape. I mean, I've tried to act very smart because you were talking about TME Telegram. I've actually made a mnemonic out of my Telegram channel. So TME for Telegram is going to be PSC, that is Preeti Sharma channel. So you'll always remember that trichophyton, microsporum, epidermophyton has PSC macroconidia. Means P for pencil shaped, it is going to look like this. Then S is going to be spindle shaped. You know how to draw a spindle, so there you go. And C is going to be the club shaped, which is going to look like this. Now maybe the examiner is not a TME PSC person. Maybe the examiner wants to write something else. So you'll have to act a little smart over here. Now instead of a pencil, if the examiner wants to describe it as a cigar, it means the same, because the cigar also looks like this. Instead of spindle, if the examiner wants to write fusiform, it again means the same. So you can play around with the words, but the essence remains the same. And now let's see all of this under pictures. The first one that I will start with is going to be trichophyton, and I hope you remember this has the maximum microconidia. So I will see the maximum small microconidia scattered over here. Now let's come to the macroconidia. Under the macro, you had to remember TME PSC. So this is the pencil shaped one, and there you go with the macroconidia. They are long and slender like the pencils or cigars. Moving on to the next one, which is going to be microsporum. The microconidia are going to become a little lesser. So they're not too much, they are not totally absent. Somewhere in between, I can see considerable amount of microconidia, but there comes the macroconidia, and as per the mnemonic here, it has to be spindle shaped or fusiform, that you can very well see over here. Now let's move on to the last one, that is going to be epidermophyton. This is the one by which the microconidia are almost gone. Look at the background, it's clean. I don't see any small microconidia. And what do I see for the macroconidia is club shaped, and you can highlight that and enumerate all of these. club-shaped organism. So trichophyton, microsporum, epidermophyton is pencil-shaped, spindle-shaped and club-shaped macroconidia, whereas microconidia are going to go from maximum to minimum. Finally, if I come back, you are done with lactophenol cotton blue, and I will just straight away write a TME PSC in front of it. The last test for this that you can do is hair perforation test, again an INI-CET favorite. What is hair perforation? You're just going to take the hair sample from the patient and you are going to incubate it with the yeast or the fungus for 2 to 3 weeks. What are you trying to find out? This test is done whenever you want to differentiate Trichophyton rubrum from Trichophyton mentagrophytes. Whenever you want to differentiate these two, you are going to do a hair perforation test. You will take the hair with the fungus and keep it for 2 to 3 weeks, because after 2 to 3 weeks, what I saw, this particular hair, there was no change. Look at the shaft, it's the same. So this means no perforation has occurred. On the other hand, this hair is showing me these wedge-shaped perforations. So do you know who is going to show you this wedge-shaped perforation or hair perforation test positive? It is mentagrophytes, whereas rubrum does not. Please note, mentagrophyte, it is ready to fight. So anyone who's ready to fight is going to tear apart everything. Very violent mnemonics coming up in this video, but nonetheless, mentagrophyte is ready to fight and far dega. It is going to perforate, it is going to tear open. So hair perforation test is positive in mentagrophyte, not in rubrum. One last thing before we go on to the treatment. What is something known as dermatophytids? If I read dermatophytids, it is the ID reaction. So this is usually seen when you start giving antifungal therapy. Let's assume that this is the main lesion of the person, whatever fungal infection that person had. So this is the first lesion. You started giving some therapy. Don't you think therapy will go and will start killing these fungal organisms? As soon as the fungal organism is killed, there will be some products that are going to be released. There is release of some fungal products, and because of this, now some other lesions will start forming away from the main lesion. So satellite lesions will form away from the main lesions, and that is known as the dermatophytid or ID reaction. So please note that it's not that the fungus has gone here and started growing these lesions. No, the fungus was primarily in the main lesion. You started giving therapy, the fungus started getting killed. The products that were released, they resulted in these kind of lesions. So can I say these satellite lesions that are formed are totally sterile? They don't have the fungal. So why are they formed? They are formed as a result of a hypersensitivity reaction to the fungal products that have been released. I hope you'll remember this again for INI-CET. Finally, coming to the treatment aspect, we first go in for a topical treatment, which is topical antifungals, usually of azole variety. You can also give systemic, that is itraconazole. Terbinafine drug can also be given as a pill, but this is for all the dermatophytes. However, all the tinea, this is how it's treated. But when we talk about tinea capitis, because that was going the most separate, it was going into carrion also, it was going into the flakes also. So oral griseofulvin is the drug of choice for tinea capitis, whereas for everyone else, it is usually the azoles as topical and azoles as drug systemic also. Finally, with this, you have wrapped up all the superficial infections, and you move on to the second category, which is known as subcutaneous mycosis. Well, I have taught you earlier that this is learnt as MRCS, and that is exactly what we are going to study. In this video, we will study the first three. We won't study sporotrichosis here because sporotrichosis is subcutaneous, plus it is also a dimorphic fungus. So this I will be teaching you with the others under dimorphic only. Right now, my focus will be on MRC. So let's get going with mycetoma. I'm starting with the foot picture because everyone knows it as the Madura foot or the mycetoma foot. So what is this? This is actually a chronic disease. It's not something that has happened overnight. It is a chronic disease which is said to be a granulomatous disease. So granuloma are formed, but that is microscopically, ma'am. What do I get to see in the patient? Like I have this foot in front of me. Don't you see some sinuses, discharging sinuses? And discharging sinuses means that the pus is going to come out. It's not that simple yellow colored pus that comes out which you've seen usually, but that pus is going to have some granules. So if I had to actually draw it out, this is how the pus is going to look like. And in between these pus, when you will see some different color granules present. Many a times they are called as sulfur granules, which I'll tell you. And it is these granules that I pick up and I look at these granules under the microscope. There, that is where I see the the bacteria or the fungus? Ma'am, did you say bacteria? Yes, because that's the catch over here. These granules are going to have the organism. So now my next question is, why did I say bacteria? Please note, this foot is going to be caused by two conditions. One is known as actinomycetoma and one is known as eumycetoma. That bacteria word was not a slip of tongue. This means this foot condition can be caused by gram-positive bacteria, and we know the gram-positive bacteria is actinomycetoma. It can be caused by fungus also, and then that is known as eumycetoma. How have I learnt it? Actinomycetoma is A ke baad B, that is bacteria. Eumycetoma is after E comes F, so that is a fungus. Let's take some examples. The most common actinomycetoma is known as actinomadura madure. So you will know that, okay, madura madure is that madura foot, but this is actino word which tells me that it is going to be a part of actinomycetoma, which is going to be a gram-positive bacteria. On the other hand, if you are told something like Madurella mycetomatus, the mycology, this will always tell you that this is to do with a fungus. So if you are asked which is the most common bacteria and the most common fungus, the answer is in front of you. But did I tell you that whenever a patient has this, there is a pus and there is going to be a color of granules that will come out. Sometimes the granules will be brown, sometimes they'll be off-white, sometimes yellow. So what are the different colors and do I have to learn it? Let's start with the bacteria first. Most of the bacteria which cause this, what are the bacteria that can cause it? Nocardia can cause this foot condition, streptomyces can cause it, actinomadura madure, which is the most common, that can cause it. Most of them come to us with a pus and granules which are off-white and yellow. The only condition in which red color granules come out is going to be actinomadura piletri. Now please note, actino word will everywhere tell you that, okay, I'm talking about bacteria, but piletri. Now that's the catch of microbiology. What it's written versus what it actually is never matches, and that's why this chapter is tough. So please note, piletri, if I talk in Hindi, it sounds like pila. So that should have been the one showing me yellow granules, but look at the irony. The pila is not pila, it is showing me red color granules. Welcome to the world of chaos of microbiology. But anyway, now all the bacteria show you yellow color granules, but the one with piletri word is going to show you red color granules. Now coming to the fungus, I think this you already know, because septate fungi can be of two types. Either they make melanin or they don't make melanin. They are known as hyaline, and I've taught you methods of learning this also earlier. So I had taught you that why am I calling it instead of melanin, melanin, because I told you anything that has the LA, like Madurella has LA, that is going to make melanin, so it's going to give you a brown color pus and a brown color granules. So the next one, that is white or hyaline, tells us that it's not going to have a melanin, it's going to be totally colorless, and the ones that come under it are going to be acrimonium and boydii. So if you look very carefully, the hyaline has the U sound, so acrimonium and boydii are the ones that come under it. Finally, talking about the treatment, I mean, it's obvious that if you're dealing with a bacterial infection, you're going to go ahead with antibiotics. So the antibiotic given is cotrimoxazole. They might want to club it with amikacin, and the duration. I have seen patients being treated from as little as 3 months to as long as even 2 years. But if we take an average, 6 to 12 months, but it's a prolonged treatment that usually goes on. So it's of course cotrimoxazole and other drugs which may be required. But when you're dealing with a fungal eumycetoma, most of the cases are dealt with a surgical amputation or a surgical debulking. But surgery can never be the first thing, because if you're doing a debulking or an amputation, you must have made sure that the drugs are not working. So first, of course, you would want to go in with the azoles. Please note, these fungi don't respond well to amphotericin B. Azoles are going to give you a better reaction, and thereafter, if it doesn't work, then of course surgical amputation. So now whatever you've read, let's look at it from microbiology point of view. First, let's look at these gram-positive bacteria under the microscope, then we'll go in for the fungus. When I talk about the gram-positive bacteria, I'm talking about actinomycetoma. I think you already remember from bacteriology that actinomycetoma or actinomyces is a gram-positive bacteria, and it is filamentous, means it's always going to look like these threads of filaments. I can see lots and lots of those purplish color threads that have made groups and aggregates over there, but I see something more. Before that, you know, everyone's imagination runs wild in their own way. So instead of calling it filamentous and thready, they ended up giving this bacteria so many names. Some people said these are looking like the rays of the sun, and hence they called it sun ray appearance. They said that some of them said these are very thin threads, just like cotton or wool. So they call it cotton ball or the woolly ball appearance. Well, people like you who might not understand the subject say that this is nothing but looking like a clump of dust. So they called it dust bunny. And then comes the scientist who wanted credit. So these are also known as Gupta bodies. So whatever they may say, they are referring to the same filamentous organism, that is sunray appearance, cotton ball, woolly ball, dust bunny and Gupta bodies. So I've seen the bacteria, but then I also noticed that around it there is a pinkish color band that is being formed. What is this pink color band known as? This is called as the Splendor-Hopley phenomena. Now whatever I'm explaining to you under actinomyces, that it shows you Splendor-Hopley phenomena, the same Splendor-Hopley phenomena apart from actinomyces will be seen later on in Sporothrix Schenki also. So what is this pink color Splendor-Hopley phenomena? You need to understand that whenever there is any bacteria or fungus, it is certainly going to be an antigen, fungal antigen, bacterial antigen, and whenever an antigen comes into your body will respond by making antibodies, and then the antigen-antibody reaction occurs. What is antigen-antibody reaction known as? It is immune complex. Those complexes will now start getting deposited, and this pink color that you're seeing around is nothing but the deposition of the antigen-antibody complex, and this is called as Splendor-Hopley phenomenon. So I can see the pink color getting deposited. What is it? It is antigen-antibody complex. Where else other than actinomyces is it seen? In Sporothrix Schenki. This was obviously to do with actinomyces. Do you want to see a fungus also? Let me show you a picture. I mean, I can't see the fungus over here very well because this is a pathology slide, a biopsy that has been done, but what I can very well see is a brown color. I told you brown color will be to do with melanin, and melanin is produced by fungus Madurella. So most likely because of this brown color and melanin, I thought of Madurella exophylla as the organism causing it. Finally, moving forward, we are done with M, that is mycetoma. I move on to the R, that is rhinosporidiosis. I think everything in its name is pretty much self-explanatory, but I'll try to make more sense into it. When I use the word rhinosporidiosis, obviously the organism is easy to guess. It is Rhinosporidium seaberry, and the rest of the story is within it. Rhino word will tell me that this is going to cause infection primarily in the nose. Yes, nasal cavity, but that doesn't mean only in the nasal cavity. It can cause infections in genitals and other cavities of the body also. So the rhino word has been done justice to. Now I go on to C. C means, or if I change the spelling, C sounds like water, and that's the catch over here. Do you know till now Rhinosporidium was considered as a fungus, and hence I'm teaching it to you over here, but now it has been reclassified as an aquatic protozoa because it is more commonly found in the sea and the water. So how does a patient get exposed? There will always be a history of someone swimming, and it is usually where the water bodies are more, that is towards South India. So they will say there is a patient from South India, he had gone for swimming, and after that in his nose there is some kind of a growth that has come up. So rhino tells me nose, C tells me that it is now considered not as a fungus but as an aquatic protozoa, and it is coming from the swimming or from the swimming activities. Now let's move forward. The C is done. Now let's go on to the berry, because what is happening in the nose? Have a look at this. In the nose you see this reddish color polyp being formed, and that is known as the strawberry polyp. When you look at this Rhinosporidium under the microscope, you can see these big structures which are known as the sporangia. So these are the sporangia, and inside the sporangia, if you look carefully, you can see some small spores. Those are known as endospores. So it shows you sporangia with endospores. Repeating, grossly it shows you the strawberry appearance, that is why C berry, and microscopically there are going to be sporangia inside which endospores are present. So of course your next question will be, how do you culture it? Do you culture it with the usual SDA agar that you use for all fungal organisms? No, this is a non-cultivable organism, and that question has been asked so many times. You cannot culture it. Well, is there any other fungus also that you will be studying in this chapter which is non-cultivable apart from Rhinosporidium seaberry? The one that I teach you in the last, that is Pneumocystis carinii, that also cannot be cultured. It is a non-cultivable organism. Finally, of course, you ask me the treatment, and in ENT, you know, if there is a polyp, then you do the removal of the polyp, which is known as a surgical procedure called polypectomy. So these are all the buzzwords that you need to know about rhinosporidiosis. Of course, getting a question on non-cultivable for microbiology is very important. Now you're done with the first two, and now you move on to the last one of the list, that is chromoblastomycosis. Again, something that the name is telling me. Chromo is going to tell me that it is something to do with color. Some color is going to come up over here. But usually if I say color, I say colored hyphae. I don't see the long hyphae. What instead I see are colored round structures, means that is why I called it blastomycosis, because blasto means that they have become round and mycosis means that it is a fungus. So let us study a little bit more about it. Chromoblastomycosis is the name of the disease. How does someone get the disease when someone's walking barefoot? So they will always give you a history of either a forest worker or an agricultural worker, because these are the people who tend to walk barefoot, and while they walk without slippers or they walk barefoot, they have a trauma because of which this fungus enters. Now the fungus has entered and you can see what has formed on the foot. It is a kind of a cauliflower or a warty growth, that is warty cauliflower lesion, and hence comes the other name. It is known as verrucous dermatitis, because what is wart in derma known as? It is known as verruca. Because of this warty lesion, you call it verrucous dermatitis. Now you will take a biopsy and look at it under the microscope. I told you that you were expecting that hyphae will be present, but you will see blasto, you will see round structures. They are looking like those copper coins or pennies, and hence these are known as the copper penny bodies. Of course, by giving you this picture, no examiner, even the most lenient one, is not going to ask you, are these copper penny bodies? He will ask you some other names of copper penny bodies, and that is the medlar body, the muriform body, and the sclerotic body. These are other names: medlar, muriform, and sclerotic for copper penny bodies. I've taught you the entire story, but I don't know how many of you guessed up till now. I only told you the name of the disease. What is the name of the fungus which is causing chromoblastomycosis? And that's what was asked in the INI-CET exam, even in NEET PG, and it's the toughest question because the list of the organisms is very scary. If I read, it is Fonsacia pedrosi, Fonsacia compacta, Exophylla, Phylophora, Cladophylophora. What did I notice? All the FF sounding ones are going to be seen in farmers who are walking barefoot. So all the farmers who are walking barefoot, so this is going to be their foot getting involved. And which is the fungus which is going to be causing this disease? The fungus which is going to start with F, that is Fonsacia ones, Exophylla, Phylophora, Cladophylophora, and this will obviously be a traumatic barefoot implantation. Finally comes the treatment. How are you going to treat? First option is that you give drugs. For example, you give amphotericin B, but nowadays there is also a new drug that has been put up for this, and that is going to be voriconazole. That is of course for severe cases, but a new drug that is being used. Drugs alone are never enough. You will have to do a wide surgical excision because there's a big lesion. You will have to remove that also. And in some cases, not always, if needed, you might have to do a laser therapy as well. I mean, that depends from patient to patient. So it's a multimodality approach that you need over here. But now one thing that I want to point out is that you were expecting that because this had the word chromo in it, and yes, it did show you colorful things, it showed you copper penny bodies, but you were expecting those long hyphae, the colored hyphae of a fungus to come out, and this over here in the body has ended up making the round molds. So now I realize, and they ask you that is there any fungus where you can see those brown color hyphae instead of the round copper penny bodies? So these will be known as the pheoid molds. Why pheoid? Because pheoid refers to the color pigment melanin, and mold is nothing but hyphae, and that is caused by pheohyphomycosis. Look at the name of the fungus. The pheo word will tell you that, oh, it is to do with pigment, that is, it is going to be brown. The hyphae word will tell you that, okay, there are molds or hyphae that are present, and mycosis word will tell you that it is a fungal organism. So pheohyphomycosis shows you those brown color fungi, and that can also be just like chromoblastomycosis, that can also have this kind of a warty lesion, and it can have barefoot implantation as well. Finally, if I go back, I have read all the three. I am, as I told you, not teaching you sporotrichosis over here because not only is it a subcutaneous mycosis, it is also dimorphic, and I shall teach you there. But before I end, I have to practice some MCQs with you. So the question number 1 says, there's a 28-year-old man who presented with a recent onset of rash in his upper arms. The patient was otherwise healthy, no allergies, no medication or chemical exposure. Physical examination shows multiple hypopigmented, slightly scaly lesions, and the culture was isolated, but the microbiologist could not get any results on SDA regular. Which of the following fungi is difficult to isolate on regular SDA? I mean, even if I would have read the last line, I would have known the answer is Malassezia furfur, because regular SDA will not be able to grow it. It will require an olive oil overlay. Why? Because it is a lipophilic organism, and on the olive oil overlay, what it's going to show you is the fried egg colonies. Moving on to the next, you have a 30-year-old male presented with hypopigmented macules on the upper back again, and scrapings with 10% KOS show you spaghetti and meatball of a vegetarian vegetarians banana and grapes appearance? This is again Malassezia furfur. The name of the disease is Tinea versicolor or pityriasis versicolor, which is the answer over here. Next question is a previous year question favorite, that is boggy swelling on the scalp, that is also known as carrion. Carrion is caused by trichophyton, mentagrophyte and verrucosum, as I taught you. The next question, which of the following affects all three, hair, skin and nails? So it was the tri, but now it's not epidermophyton and microsporum, it's the tri. But I hope you didn't get confused. Is it trichosporon Beigeli? No, the Beigeli one was causing white piedra. It is trichophyton. I told you that under the three dermatophyte, you had to put all phyte. Trichophyton, microsporum, epidermophyton. So the answer over here is trichophyton. Moving on, all are true regarding dermatophytes except as soon as I get a question on dermatophyte, be ready for the TME PSE that would come up. Number one, are they differentiated on the basis of the macroconidia? TME PSE, yes. Epidermophyton affects skin, of course. Phyte, you need nails, that is also correct. Then microsporum has fusiform macroconidia. They are saying microsporum has spindle shape. Ma'am, spindle and fusiform means the same. So this is also correct. The last statement is wrong. Does epidermophyton have abundant microconidia? No, the microconidia go in a descending order. Maximum are in trichophyton, then in microsporum, and epidermophyton hardly has any. That was the false statement and the answer over here. Moving on to the next question. What is used for the cultivation of rhinosporidiosis? I don't have to read anything because rhinosporidium is non-cultivable. So none of these. Please don't mess up thinking it's a fungus and I'll mark SDA. No, it's non-cultivable organism. Moving on to the next question, we have an H&E stain of nodular lesion of the arm of a forest worker and the picture is shown. If I just without any bias of options look at the picture, I can see the famous copper penny body. I know it must be chromoblastomycosis. Without any doubt and without reading other options, I can come to this answer. Coming to the last question over here, we have a patient who presented with the swelling in the right foot with multiple discharging sinuses. They're talking about the Madura foot. The lesion did not respond to antibiotics. Now this is obvious. If it would have been a bacteria, it would have responded to antibiotics. If it is not responding to antibiotics, I am more commonly going to think of a fungus. Over here, actino is a bacteria, nocardia is a bacteria, sporothrix is a fungus, but sporothrix doesn't cause this kind of a Madura foot. The only one that can cause it is Madurella mycetomata, and that is the answer over here. Well, with this, you finish off two very important classifications, that is superficial and subcutaneous, and now you're ready to take on to the next one, that is the dimorphic fungus.